Hello and welcome to Progressive Education Society's Modern College of Pharmacy e-lecture in the subject Natural Drug Technology. This topic will deal with traditional systems of medicine and will focus upon homeopathy as per the syllabus of Savitribai Phule, Pune University. Homeopathy was developed by German physician, chemist, and pharmacist Dr. Samuel Hahnemann. Homeos means similar and pathos means treatment. The entire system is based upon a theory of similia similibus curantur, which literally means like cures like. Drugs that produce similar symptoms as the disease in a in an healthy human being are administered for the treatment. The fundamental principles on which the entire homeopathy is based upon are law of similia, law of simplex, law of minimum, drug proving, drug dynamization or potentization, vital force, acute and chronic diseases, individualization, and direction for of cure. First law, that is law of similia, it states that the drugs used in the disease, if given to a healthy individual or healthy person, should produce same symptoms as found in the diseases. We'll take an example of malaria. The infected person exhibits symptoms such as fever, a fever accompanied by chills. Dr. Hahnemann observed that if an healthy individual is administered with cinchona bark, he shows symptoms similar to malaria. That is the reason why he tried cinchona in malarial patients, and to his surprise, the infection was cured. The symptoms disappeared upon administration of cinchona. Thus, the symptoms of disease are to be matched with the pathogenesis caused by the drug. Second law, that is law of simplex. Simple and single drugs are prescribed at a time. Drugs are initially proven in healthy individuals and they are administered one at a time and in extremely simple form. Third law is law of minimum. Drugs are administered in as low dose as possible, that is minimal quantity, to prevent any hypersensitivity. Moreover, the chances of adverse effects can also be avoided if the drug is administered in minute doses. Fourth is drug proving. An ability of a drug to cure a disease or a symptom is dependent upon its ability to produce disease like symptoms in a healthy individual. Hence, appearance of disease like symptoms in an healthy individual by the drug proves its curative power or curative ability. Fifth is drug dynamization or potentization. Homeopathy believes that diseases are caused due to dynamic powers. So the treatment should also involve drugs having dynamic powers. The system believes that dynamic powers are hidden within the drug and are to be awakened by means of either trituration, that is mechanical trituration, or succession. Now, how to release the hidden healing force from the drug, how to achieve its potentization, or how to dynamize the medicine. This can be done by preparation of potencies. Potencies can be prepared in three scales, that is decimal scale, centesimal scale and millisimal scale. Now we'll discuss about the potentization or preparation of potencies. First is decimal scale that was put forth by Dr. Konstantin Burning. This is similar to serial dilution, which we normally do in the practicals of micro or analysis. In decimal scale, uh, if you need to prepare first potency, the drug is taken as one part and it is diluted to 10 parts with the help of a solvent. Now this results into formation of first. Similarly, second potency can be achieved by serially diluting this first potency drug by 10 times and so on to achieve the desired potency. Here, the potency is denoted by suffixing with x to the number indicating the potency. That is 1x potencies, 2x potency, etc. Similarly, on the same grounds, centesimal scale is also developed. The difference between decimal and centesimal is in centesimal scale, the first potency is developed by diluting one part of the crude drug to 100 parts of the solvent. That means this is 10 times more dilute than the first potency of centesimal scale is 10 times more dilute than first potency of decimal scale. And if you want to prepare second potency in centesimal scale, again the first potency is serially diluted to 100 times. Now we'll see how it is denoted by suffixing with letter C, and here we'll see the relation between decimal and centesimal. 1C is equal to 2x. That means one first potency in centesimal scale is equivalent to second potency in the decimal scale. Similarly, millisimal scale is also developed. Here, the first potency is prepared by diluting one part of original crude drug to 50,000 parts of the solvent. And likewise, second potency is prepared by diluting one part of first potency with 50,000 parts of the solvent, and so on. This is generally denoted by 0 by 1, 0 by 2, 0 by 5, or etc. Now this is the way how different dilutions are prepared for potentization. Different methods involve different dilution strategies, such as in trituration method only decimal and centesimal dilutions are made, while in succession decimal, centesimal or millisimal dilutions are prepared. Sixth is vital force. Homeopathy believes that disease is caused due to disturbances in the vital force present in our body. Hence, treatment should also aim to restore the disordered vital force to normal level. It says disease and health are two different quantitative states of this vital force. Seventh principle is acute and chronic diseases. Classification of diseases into these categories are based upon onset of the disease, nature of its progress, whether it is rapid or slow, and termination, that is end of the disease, whether it leaves a permanent disability, deformation, or a mark. Eighth is individualization. As we have discussed earlier, almost all the TSMs strictly adhere to individualization approach for treatment of disease. Same diseases affecting two different individuals is not treated similarly. Last is direction of cure. Dr. Herring states that the direction of cure or healing takes place from within to outwards, that is, the outward direction, and the symptom disappears from top to bottom. That means if the direction is reverse of that stated, then it is not cure but suppression which has occurred. Usually the symptoms they disappear from top to bottom and from within to periphery, from within to outside. These are few of the references I've referred.